Welcome back to the Healing Wellness Show, where we bring you practical conversation on science, lifestyle, and real world healing. I'm your host, Dr. Karim, and we're going to be talking about a topic that lots of people have been wanting to know about or hear about on the news. And today we're going to be diving into stem cells. You've seen the headlines, you've heard the promises, so what's real? So to help us cut through the noise, I'm joined by Dr. Dan. He's a clinician, educator who works extensively in regenerative medicine. Dr. Dan, I'd like to welcome you to the show. Just tell us a little bit about you for those viewers and listeners that haven't heard about you.
Sure. So I'm a DO, which means I studied osteopathic medicine. I've been in practice for about 20 years now. I've been doing regenerative medicine for about 15 to 16 years now. I started with PRP, which is kind of the one most people start with, and then have kind of expanded into a lot of different procedures, including stem cells. And I've been doing bone marrow stem cells for about 12 to 13 years, basically from neck to toe, and we get very good results from what we do.
Excellent. Excellent. Well, why don't you just start off and just let us know, what are stem cells?
Yeah, so stem cells are immature cells that have not differentiated into other types of cells. We have these cells in multiple areas, our bone marrow being one, our fat being another good source of stem cells. And there are some stem cells that circulate in blood, but you never get a higher concentration to actually use them as a procedure. However, we still do use the blood for other things like PRP. That's another thing that I do called A2M, which is like a protease inhibitor that gets rid of chronic inflammation and can help with things like post-traumatic OA and stuff like that.
And why are there's a hype on stem cells about healing in?
Yeah, because they have a ton of healing potential. They have a significantly higher level of growth factors than your platelets do. The old thought process on stem cells was that when we inject them places, they differentiate into those other types of cells. That's really kind of been changed as far as the thought process. And what we're really seeing is it's just those super amount of growth factors going in there that causes all the good stuff to happen. That stuff with the differentiation and turning into cartilage and muscle and all that other stuff does happen in labs and in all that stuff. But in the body, that doesn't seem to be the way it works. It seems to be more that huge growth factor release that goes in.
And what types of stem cells are there?
So there are two main types. The term stem cell has kind of changed. So it used to be MSCs, or mesenchymal stem cells. The wordage that they're kind of want to talk about, call it now, is medical signaling cells, because unfortunately there's a little bit of taboo with stem cells because there's some other things going around, like umbilical and all that stuff. But, your MSCs are the ones that do gear more towards muscle and tendon ligament type stuff. And then there are hematopoietic stem cells, which are HSCs, which are more blood, red blood cells, platelets, white blood cells. That's what develops from those HS.
And then I know you mentioned that the ones that you use, you get from bone. Is there any other places that you could get stem cells, or are there other clinics that do different kinds of stem cells? And what's the difference between
so
doing
I
it?
would say the other one that is pretty common is adipose. So the fat cells. Our fat cells are very rich in the MSCs, even more so than the bone marrow. But the data kind of shows that there's not a statistically significant difference in the outcomes, but I think each has its place, So some people just strictly do bone marrow, some people just strictly do fat. I think there's room for both, depending on what you're treating, So because the fat is very thick and sticky, and if you put it in something like a partial tear or something like that, it really just kind of adheres, where the bone marrow does clot pretty quickly, but sometimes can just kind of drip off, So again, I think there's a place for each. The other area where you can get regenerative products is made in a bottle, however, there's no real living cells in there, just because it has to be processed and filtered and cryogenically frozen or dehydrated. And through that process, there's maybe some growth factors there, but there's really no living cells. The other issue with those cells, as far as I'm concerned, is just the FDA is pretty strict on those right now. And it's just kind of a hotbed topic. So.
Is that more like the umbilical cord ones that you're
Yeah,
talking
like
about?
the umbilical, Wharton's jelly, amniotic, all that kind of stuff. Yeah.
And what's I would say the difference between, say, bone and like umbilical cord?
So yeah, I mean, if you go by like the people that sell those products, they're going to tell you that yeah, obviously, the feel I feel all the time is you're old, these are baby stem cells and they're just way more active. There's really good data though that shows that as we age, do we have a few less stem cells? Sure. Are they maybe a little less active? Sure. But did that make a difference in outcomes? Not really. It showed that until about the ninth decade of life, you're still a pretty good candidate. Now, that being said, I would say if you're just chronically diseased, if you have a lot of chronic disease, a lot of, autoimmune type stuff, then probably your stem cells aren't that good. But, I do these procedures on people well into their 80s and they do great. So,
Okay. And how do stem cells potentially influence like inflammation or tissue signaling or repair?
yeah. So what they'll typically do is they will cause an acute inflammatory response, try to bring some healing there. Most of the areas that we treat with any regenerative treatments, it's because it's chronic, because we tried everything before we get to that, So what it basically is doing is it's using a little acute inflammation to get rid of all that chronic inflammation, and then it does help with repair of tissue as well. It can help remodel tendon, ligament. There's even a couple of studies that show that stem cells could definitely put a little tread back on the tire with arthritis, if you're not bone on bone. We used to say that platelets couldn't do that, but although there was a study that just came out either this year or last year that showed a little amount of cartilage, so again, we can actually regenerate some of these damaged tissues, which is great, partial tears, even some full tears if the two pieces are together here. I like to say if it's retracted like this, you could shoot any cell in there all day long. It's not going to bring them together, but definitely a lot of use.
And do you still use plasma with stem cells or
I do.
plasma?
I mix some PRP in there as well. I
Okay.
just think getting more growth factors in there, just, throwing as many healers as you can.
So, Doc, what got you interested in doing stem cells? Like, for you, why? Why did you get into that?
So actually, when I was in medical school, I was convinced I wanted to be an orthopedic surgeon. And then by fourth year of medical school, I was able to do 4 orthopedic rotations in a row because you get all your electives. And, the more I did it, I was just honestly a little bit less interested in it. And then I started kind of looking at other avenues of, I love treating injuries. I played sports my whole life. I'm into all that stuff. So how could we do this, without all needing all these major surgeries and all that stuff? When I was coming up, regenerative medicine was relatively new. As I was in med school, it was just PRP was just getting into like a mainstream in the medical world. It's been around forever in dentistry and horse racing and all that stuff. 16, 17 years ago, it started really coming into orthopedics. And it was just fascinating that, you take this patient's own cells, you just spin them, concentrate them a little bit, you inject them and it heals stuff, rather than having to go for a surgery and a huge recovery and all that other stuff. And then obviously, with the advancements in ultrasound, we can hit almost anything. Probably the only thing that I can't do on ultrasound as far as injections go is, epidural into the spine type stuff, just because you lose the needle. But other than that, I could treat pretty much every joint, nerve, muscle in the body, which is nice.
So, what are some of the patient factors that influence results? Like, example, like age or activity level, metabolic health. Like, what are some of the factors that influence that you're going to get good results?
Yeah, I mean, I would say probably the biggest factor is just overall health, metabolic health. If you're 30 and you have a ton of chronic disease, you probably don't have great stem cells, but you could be 80 and very healthy and have very good stem cells. Does age factor in a little bit? Yeah, sure. I mean, age always factors in healing. We joke around in sports medicine that you get injured in your teens and it takes 2 days to recover. In your 20s, it takes 2 weeks. In your 30s, it takes 2 months. But yeah, I would say more so it's the genetic makeup of the patient and if they have chronic disease and if they have healthy cells, they do very well, even at a pretty old age.
So, what does success mean in that field? Is it like more towards like less pain, improved function? Is it delaying surgery? How would you define success?
I mean, I would say that that's all success. Yeah, everything you said, I think, is 100%. I mean, what is the most important to me is pain and function. You can get an MRI and with someone with no pain, and you'll find things wrong. But if they don't have any pain and they have full range of motion and full strength and no pain, and it doesn't bother them, okay, we know we can heal those tissues. In medical practice and clinical practice, we can't get serial MRIs just because they're not covered by insurance. But we've seen in studies that happens. But what we go by is honestly how you feel. So if I'm treating a labral tear and you haven't been able to military press for a year and, 10 weeks later you're doing it again, that's a good sign to me, Yeah, so that's, I think, really the most important thing as far as success. Now, even avoiding surgery, something like a knee replacement or a hip replacement to me is successful. And why is that? Because the longer you can wait for those procedures, the less likely you're ever going to need another one. So if you get that hip replacement done at 50, there's a really good chance you're going to need a revision somewhere before, at 70 or 75, or maybe even earlier than that. So if we can take that 50-year-old patient and even just buy them time with the stem cells, or any regenerative treatment, I think that's great for the patient. The other thing is, Ed, again, if we're just kind of kicking the can down the road a few years, the surgical technology is going to be better. You're going to have a better implant. You're going to have a newer technique. And honestly, regenerative medicine is always advancing. So we might get to the point where, hey, you know what? Maybe 10 years down the road, we can fully put cartilage back on that joint or something like that. We're not there yet, but again, we're always advancing just like every other field in medicine.
All right, Doc. So let's switch over and talk about safety. So what are like typical risks or, procedure related and like infections, like screenings, like just safety? Why don't you tell us a little bit about that?
Yeah, I mean, the beauty is that if it's done right, it is an extremely safe procedure. Getting the bone marrow, although it sounds pretty bad, it's very easy. I do it through ultrasound. I find the back of the hip, an area called the PSIS, which is a nice fat part of the bone. Numb the skin, numb the tract down, numb the periosteum, which is the part of the bone that really feels anything. And then I put the trocar in, and we do have to hammer into that bone marrow, but still, very low risk. Infection, anytime you break the skin, you have to say infection is not a zero risk, but it's a very low risk. We do it very sterilely. There's no open wounds, big open wounds. And in fact, some of the cells that we're extracting are cells that fight infection to begin with, So I would say even when we're injecting it into the joints or the tendons or the ligaments, I would say the chance of infection is significantly less than if it was a steroid injection or anything else, So very low risk. Obviously, has to be done properly and with someone that's trained properly. The area that we go into in the back of the hip too, there's really no major blood vessel. There's no major nerves there. So you don't have to worry about damaging those neurovascular structures. One of the risks of doing the bone marrow trocar is when you go down the cavity, if you go too far, you can kind of come out the other side. Now the good part about that is, again, even if that happens, it's a very safe area. You're basically just in soft tissue. The other thing is now these newer technologies avoid that, because once we get into the cavity, now we can change that to a blunt probe that goes down instead of a sharp going through. Yeah.
Nice. So what, for the patient wise, what would be recovery look like? How long? Are they, bedridden for a bit? Like, why don't you tell us about that?
No, I mean, just from my world in sports, you'll almost never, I don't shut down anybody completely unless it was absolutely necessary, like a bad fracture or, just post-surgical type stuff. I want them moving now, being careful for about the first week or so. Definitely, basically what I tell my patients as far as recovery goes is the first week's going to hurt. I always say prepare for wherever we treated to be very sore, maybe even swollen for about 7 days or so. The first 2 to 3 days are typically the worst. Then what most patients will experience is it will feel like we did absolutely nothing for a while. Regenerative medicine, the one thing I think anybody that does regenerative medicine should stress to their patients is it is a very slow process, as opposed to something like a steroid. But you do give a steroid injection, 2 days later, people feel better. But the steroid's not fixing anything. I always tell people, because I get the question all the time, why does it take 6 to 8 weeks to start working for most people? And the answer is really, that's our body's natural healing time. I always like to say, think about if you get an injury, you strain a tendon or sprain a ligament. What does the doctor typically tell you? About 6 to 8 weeks until it heals. You break a bone. How long are you in a cast for? Most people, somewhere between 4 to 8 weeks. So that's just kind of the pace that our body works at. We're putting those healers there. So I think the one thing I always have to stress with people is patience, because and even after I tell them that, sometimes, they'll come back at 8 weeks, and I tell them from the start, 6 to 8 weeks is when the healing starts and then builds up for months past that point. I mean, there's one study that showed with the stem cells that it was up to 18 months, people still felt like they were feeling better. I find that between that 6 to 8 week mark and about that 6 to 7 month mark is where the bulk of the healing happens, but I always tell people, if at 8 weeks, if you're 15, 20% better, for me, that's good. Obviously, if you're 70, 80% better, that's fantastic. But that doesn't mean it's bad if you're not that well. And typically, and I follow them up about every 4 weeks until we kind of reach a place where we're doing really well. Sometimes, even with the stem cells, what I will do is if necessary, if the healing is really slow, I'll boost it with some PRP somewhere down the road. I usually like to wait about 12 weeks or so to even consider starting to do that. Or if they've gone like 2 or 3 months where they're just kind of plateaued, like they're just stuck at 50% better, sometimes that little extra platelet can just kind of shoot them through.
All right, Doc, why don't you walk us through what a model patient journey looks like? Day one, the console, all the way through doing a procedure.
Yeah. So, a lot of it depends on what they've already done before they've seen me, so a lot of people that come to see me are coming because they've tried the typical stuff, and they're being recommended for surgery, or, they've seen that the next step is surgery and they've researched it. Or some people are just coming to me as a new patient with, that they've had this problem for a few months. So depending on where we're starting is where I start, so if they're just starting out, they haven't tried anything, I'm going to put them through the typical protocol, physical therapy, try, maybe even a steroid injection if necessary. And then if the easy stuff kind of fails, then we'll have the regenerative conversation. When I do my regenerative medicine, I typically really do like to have an MRI prior to, just so that I know everything that needs to be treated, So I think the other place where I think some providers just go wrong with regenerative medicine is, let's say, knee arthritis, right? But then you get the MRI and it shows an MCL strain, meniscal pathology, maybe some muscle type stuff. And if you just go and you just inject into the joint, will you get some results? Maybe, but if you treat all those areas that need to be treated, I think you get way better results, so typically if we're having that regenerative conversation, either I'm going to ask them if they've had an MRI. If not, I'm going to get one. Then we consult back. We talk about it. Again, go over all the options with them, and then we get them set up if that was something they want to do.
Nice. So what about aftercare plan? Like, what does that look like? Is there like physical therapy or nutrition, or when do you reassess? Like, what does aftercare look like?
Yeah. So my standard aftercare, some of it just depends on what's going on, right? So my standard aftercare is pre-care is I keep them off any anti-inflammatory medication for a week before. So your Advils, Motrins, Aleve. Why is that? Because they make your platelets dysfunctional for a short period of time. If I'm going into bone marrow, I don't want it oozing too much, and I actually want that clotting to happen. So those cells can inhibit that a little bit. And plus, they kind of inhibit that acute inflammatory response that we're looking for. And then I keep them off it for an additional 2 weeks, just so that those cells can get to work there. Depending on the area, I may compress it or brace it for about a week or so. Yeah. I also recommend no ice to the area that we treat for about a week, because I want that inflammation to happen. Now, some people, if they get that like a real big inflammatory response, I will say to ice it lightly, because I don't want too much inflammation either. My typical shutdown period kind of depends on what's going on. If it's arthritis or something along those lines, I just usually say that first week, while it's really sore, just take it easy. not sedentary, but you could walk, you could go to the store, just listen to it. Don't try and jog or run or do anything heavy, for about a week. After that first week, I do recommend starting some physical therapy because I think strengthening the muscles around anywhere we treat is always a really good thing and can help with, you know, just the outcomes in general. Now, if it's something like a partial tendon tear or a partial ligament tear, especially if it's like a high stress area, I will take it relatively easy with those patients for somewhere about 4 to 6 weeks after, but I do start some physical therapy. I let them do some modality, some range of motion stuff because I don't want them getting stiff. When we started doing regenerative medicine, it was a much bigger shutdown. We would put people in knee immobilizers, put them on crutches and all this stuff. And honestly, what I found is getting the joint moving soon just gives better outcomes, because just the joint being immobile can cause stiffness, and then that stiffness can cause pain for months, and it can take months for it to loosen up again. So the way we do it, I just don't see that. And then I think it just works way better.
And then obviously this is not an insurance covered procedure. Is
Yep,
that correct?
that's correct.
Okay, so let's talk about if you were the patient, what are some of the things that you'd want to ask a provider? Because, there's people shop, right?
Yep.
So some people will go for the cheapest, some people will go for the most expensive. So what is it that if you were a patient, what are some questions that they should be asking to find out what is best for them
Sure.
as a patient?
Yeah, so I would certainly never go for the cheapest because if you're going for the cheapest, you're probably getting a cheap product. I would ask which system is used and maybe do a little research about that. Because the system there's a ton of systems out there now, and very few of them do the job that you really need. I would certainly ask if it's being performed guided. I think if you're doing regenerative medicine blind, you might as well just honestly just shoot it down the sink because if I think regenerative medicine is all about precision and you have to hit those areas exact. With the steroid injection, although I do all them guided, but if you come close, you'll get like a global anti-inflammatory effect. If you do like a stem cell or a PRP procedure and you don't hit that spot exactly, you really did pretty much nothing, so make sure that it's guided, make sure it's with someone that's really trained in ultrasound. If you're doing spine, maybe fluoroscopy, that kind of stuff. I think, the reason why some of these systems don't work is they just don't give the platelet concentration that you're looking for. The newer studies are showing that unless you're getting like 5 to 10 billion platelets or, into that area, cells into that area, you're just typically not going to get the effect that you're looking for.
What are some of the top myths that you hear about stem cells?
So I would say as far as myths go, again, I think, just based off of the data right now that the umbilical and Wharton's jelly and all that other stuff is better than your own body. I'm a firm believer that, your own body has all the potential to heal. You just got to sometimes put the healers in the right place because they can't get there on their own. Again, that the cells are differentiating into other types of cells, although we even thought that for a while, but that just doesn't seem to be how it's working, and I think not myths, but I think there's a lot of misnomers and almost false advertising about regenerative medicine. Like, I don't know about you, but I've seen ads where, there's ads from a place that does it, and there's a bone on bone knee on one side, and then you see this nice spaced out knee like this, and, they're trying to promote stem cells, and it doesn't do that. Now, could you take a bone on bone knee and get that patient feeling better, more range of motion, less to no pain? Absolutely. But it's not putting all the tread back on the tire. It's just not doing that, so I think that's probably the biggest myth. And that's honestly propagated by providers, but, yeah, that's the one that always gets me.
So what would you say some red flags that patients should be aware of, like while they're in a consultation, they should pump the brakes and kind of avoid that place?
Yeah, I mean, I would say that unless it's a doctor that's really trained in regenerative medicine, that uses guidance when they do their stuff. Again, from my perspective, I know a lot of people do it, but, I tell people that if, they're trying to sell you the umbilical stuff, that I would not recommend it. things like that. Yeah. Obviously you want to go with someone that does it a lot and is not just kind of doing it as a side hobby, do 1 or 2 PRPs a year, but you want to just make sure you go into a reputable place with someone that's properly trained.
And then if someone's not a good candidate for them, what would be the next like smart alternative or next steps for that person?
I mean, it all depends on what the issue is. So let's say knee arthritis. I mean, could you try things for pain relief, like a genicular nerve block or a genicular artery embolization or something like that? Honestly, times, listen, I try and avoid surgery for people as much as I can, but sometimes that's the answer. It just is. Yeah, it depends on the area you're treating, but sometimes either it's just past the point of where regeneratives are going to work, or sometimes we tried the regeneratives and it still didn't get us what we're looking for. Mixing in things like laser therapy, I think, is great. There's a lot of good evidence that doing shockwave therapy before regeneratives and after actually improves the outcomes significantly. So there's a lot of things we can do, and honestly, very little people have to go on to that surgical outcome. But like, again, I'm someone that tries to avoid surgery. I tore my patellar tendon and had to get it fixed. It just is what it is, because the tendon being this far apart, it's never going to come back together, so unless you put it back together. That being said, afterwards, I do regenerative medicine. I did it on myself and I do it on people after, certain repairs. And I think it really helps that repair to heal better, especially if you're dealing with some kind of degenerative tissue to begin with, because you repair degenerative tissue, it's a much higher incidence of tearing right back apart, where if we can get some good cells in there, sometimes we can help that tissue heal.
And then is there any new studies that you're kind of, looking at, or new technology or anything like that you think is coming down the road?
Yeah, so I would say there's some really good studies. The one that I really love is, one of the biggest, I would say, advancements in regenerative medicine and stem cell treatments are intraosseous injections. Okay, so because what we found is that if you just treat, like, say, the knee inside the joint, but that person has a lot of subchondral swelling and edema underneath the bone, if you don't treat that, the outcomes are nowhere near as good. So now what we can do is we can drill into the bone and actually put good, healthy stem cells in there too. So there's a study by he's a French orthopedist. His name is Philippe Hernegal. I think it came out in 23. But what he did is he took, I always forget if it's 120 or 140 people, but it was about that number of people that had stage 4 bone-on-bone arthritis in both knees. And what he did, which I thought was really interesting, is in every patient, he did a bone marrow stem cell injection with intraosseous on one side, and he did a knee replacement on the other side. And then he followed them up for 12 to 15 years. And what he found was that only about 1.1% of the stem cell side per year had to go on to a knee replacement, which is a very low amount. And to put that in perspective, that was about the same percentage of people that had the knee replacement that needed other things to help in the recovery, like a secondary surgery or something like that. Yeah. So very good long-term data, which is pretty awesome. As far as new technologies come out, there's a new laser that I haven't gotten my hands on yet, but I want to. It's called the Regenerative, and it's not just your typical laser wands, which I have, and I think it works great, but this also has an 18 gauge needle that you can put into joints or into other tissues, and then you can actually put that laser energy directly there. There is some evidence, it's still very early on, that mixed with regeneratives may actually help develop things like cartilage and a better repair and stuff like that. But yeah, very interesting. So you could do it in the joint, and then you could do the topical laser afterwards too. So it's pretty cool.
Awesome. And then any success stories that stick out that you can share with us, if you can share a couple, that would be awesome.
Yeah, I'd say, I treat a good amount of athletes. I would say probably my best success story was she probably late 20s, early 30s. She was an elite level CrossFitter, like national level type stuff, but she had a shoulder injury and she wasn't able to do the clean and jerks and all that stuff for about a year and a half. She was diagnosed with a labral tear in the shoulder through MRI. She came to me because she didn't want the labrum repaired. She wanted to try a non-surgical route. And we did bone marrow PRP on her. And then actually by 8 weeks, which is super early, she sent the video to my in my social media site, and it was her pressing 150 pounds over her head. So at 8 weeks, that's pretty fantastic. I treat quite a bit of arthritis, shoulder arthritis. I had a patient who was completely bone on bone. His range of motion, typical range of motion for the shoulder inflection is 170 to 180 degrees. He was at about 60. Okay. And that was it. He was stuck. So we talked about it, we talked about possible shoulder replacement and all that stuff, but he didn't want to try surgery. So we tried the bone marrow and the PRP on him. And about 10 to 12 weeks later, we got him up to about 130, 140 degrees of range of motion. His pain was gone. He was able to do things again. And we have a lot of stories like that, So from very young athletes to very old, even relatively sedentary people, we get good results.
That's awesome. That's awesome. Well, Dr. Dan, thank you for sharing your wisdom with us today. Any last words or anything that you'd like to share with the audience?
At this time, if anyone's in the New Jersey area and they want to come see me, you can find me on Google. I'm a physician at One Oak Medical. We have multiple locations, but my main locations are Tinton Falls, New Jersey, Princeton, New Jersey, and probably coming soon, Toms River, New Jersey. The website is oneoakmedical.com. And the phone number is 732-385-2739.
That's good, Dr. Mo.
Well, thank you again, Dr. Dan, for sharing your wisdom and everything that we would want to know about stem cells today. So to our listeners, if today's episode sparked questions, talk again with a qualified provider who can evaluate you and, get to your specific case needs. If you found this helpful, please follow us on the Healing Wellness Show, whether on Spotify or Apple Podcasts, and share it with a friend who's exploring options with whether knee pain or tendon injuries. But you can also catch clips on Instagram and our Facebook. Again, I'm Dr. Karim with the Healing Wellness Show. Thank you for listening, and we'll see you next week.